So it kind of, this is the passport. I've got a PowerPoint that I'll show you, but I just thought I'd start off to show you what a hospital passport looks like. Some of you may well have come across these before, but for those of you that haven't, I just wanted to go through basically what a hospital passport is and how important it is. So first of all, that's the first screen, the first page of the hospital passport, and you can see it's kind of quite a visual thing. If you see that printed off in colour, people will see that straight away. In a nutshell, what this is about is that I want you to imagine the person that you're caring for, your loved one, is in hospital, and they're on their own. Obviously, you know, when you're able to be with your loved one, you will be there and all the rest of it, but certainly the way things are at the moment, that might be really difficult. And if you think about an average sort of hospital ward and how busy that is, and all the different shift patterns and a number of people that are going through that ward, we need some way for someone with a learning disability who will have communication problems, or may have serious communication problems, thinking about Nicola's presentation about pain, as much information as possible that we can share with the team that's caring for that person. It's really important. And the hospital passport is basically that's basically what we're doing. So actually, do you know what? I'm going to flick back to the presentation actually, because that'll probably make a bit more sense. So really what I've showed you roughly what that looks like, and I'll go through that in a bit of detail just in a minute. But basically what we're going to cover in this session, I'm not sure because I can't see a time on this screen, so I don't know about timings or whatever, but what I want to cover is a standard hospital passport. And we've actually got a condensed, truncated version of the hospital passport for COVID-19. So I'm going to show you both so you can see what they both look like. I want to talk about why they're important, and also I want to spend probably more time talking about what a good quality one looks like, because I see some fantastic hospital passports, and I also see some ones that are really not really that helpful. And I just want you to think of a hospital passport as being the opportunity for you to represent that person, to give as much information as possible. The more detail, the better, and I'll cover that and give some more examples in a sec. So hospital passport doesn't get you through customs. It will get you better and safer care at hospital. People with a learning disability have more health risks than neurotypical people, and quite often they will struggle to communicate. People with mild learning disabilities may well not understand things fully, may not be able to express themselves fully, and obviously those communication barriers become even more severe with the severity of the learning disability. So the hospital passport is about communications and helping understanding, and the idea there is that if you have successful communication, good quality communication leading to better understanding of that particular individual, that is going to lead to better care. Okay, so as I mentioned, I've just showed you the front page of a hospital passport so you get an idea of what I'm talking about. But basically the standard one that we're using in our 4 boroughs, the NELFT one, it's been around for a long time, and I hope lots of you have seen it, but hopefully I can give you a few tips and tricks and tips that might make it much better quality when you're completing them. Obviously your local learning disability team in each borough, this is our bread and butter. We'll do these things as a matter of course, but that, you know, quite often carers, providers or families can complete these, and quite often they'll do a fantastic job of that, but we do it day in, day out, so we try and make sure they're really good. The standard hospital passport is divided into three sections, and you noticed on that front page I showed you that you've got this kind of red, amber, green traffic light system. Red is that these are things that you must know about this person, and right up front there's stuff about communications, and again that picks up on what Nicola was saying about pain. You know, it's really most important to understand how this person communicates. I'll come back to that. Amber is things that you should know, and that breaks things down into some of the what nurses will call activities of daily living. So it sort of breaks it down. So there's some real focus around particular issues of communication and knowledge about that person's presentation. So the standard NELFT hospital passport is about 10 pages long, and it's got some really personal, well, it should have, if it's a, I have seen hospital passports where it says not reported, not reported, not applicable, not and that, to be honest, isn't really very helpful. Even if something isn't relevant, you should, you know, or not a particular issue for that person, something should be said there so that we know what the baseline is, and that will make more sense as I go through the form. The COVID-19 version is literally, I mean, obviously when you start, the boxes are expandable. So as you put more detail in, the ones that I've done, they kind of go over to at least 2 pages, because I try to put some detail on there because it is actually important. But the COVID-19 version is when you print it off, and I'll show you what it looks like in a second. It's literally one page. The one thing that sounds like I'm criticizing this one, but I mean, if your name is John Smith, that could be a little bit of a problem, because the only identifying detail on that one-page detail COVID-19 hospital passport is literally the name. So it might be an idea to put a name and something else, I don't know, like a date of birth or something, I don't know, but there's literally only a box for a name, and then straight away next of kin and contact phone number. That's all there is in terms of identifying details on the COVID-19 version, but it's specifically around the main communication issues. Standard one, the 10-page NELFT one, it's basically in sections, but you've got personal details, so it's got date of birth, all that kind of stuff. Communications right up front, how to communicate this to this person, and that's, communication's a two-way thing. So it's about tips for how you can communicate well with this person, and also how they present in terms of their communication. You know, are they verbal? Are they non-verbal? Do they use signs? You know, do they use noises? Those kind of things, facial expressions, that kind of thing, about how they communicate back to you. There's a section about pre-existing health issues and medication, which again helps the care team to establish a baseline for this person's health as they present out with whatever they're presenting with at that particular time. How they cope with procedures. So quite a lot of learning disability nurses around the patch will spend time supporting families with blood tests, x-rays, CT scans, all those kind of things that even for neurotypical people can be quite scary. But for people with a learning disability, it can be like almost a complete showstopper. And we do a lot of work on trying to support families to get into these things. And it's really useful for a care team to know that, you know, if you start trying to put a needle in someone, they're just going to go completely up the wall, and you need to make sure that people understand that. And you know, so a lot of people are fine with it, other people aren't. How people take their medication. Some people may have dysphagia or issues around that. Other people might just not be able to swallow a tablet, not actually be able to do that. So they might need their medication in liquid form. So there's some stuff there. Personal care, obviously, if someone is an inpatient hospital, they will have to be supported. And again, it's good to know what the baseline is, so that no matter how that person's presenting today, you know, in a few days' time or a week's time, we need to know what baseline they'll need to get back to, and with an aim to put a care plan for that person to get them back to what their standard baseline is. There's a section about mobility, about safety, about how one keeps this person safe. I can talk about that a bit more. Eyesight and hearing. So, you know, an old chestnut might be like wears glasses, or no problem. You can put on the hospital passport, no sight issues, but actually they do wear glasses. Sometimes they might need glasses for particular things, maybe glasses to watch TV or glasses to read, or that they might have an issue with glasses that they don't forget to put them on, need to be prompted to put them on. So again, little details like that can be really, really helpful. Anxiety and behavior, so some stuff about how someone might be in terms of if they're feeling anxious, and probably more importantly, what things might calm them down. Sleep patterns, diet and drinking, all those bits from about personal care through mobility, right that down to sort of diet and drinking, are the amber section. So these are things that you really should know about this person to provide better care for them. And then the green section of the hospital passport's about likes and dislikes. When I'm doing a hospital passport, I really like that bit, because that's the bit that really helps a care team connect with that individual. It may sound like little things, but if you get presented with food that you just don't like, and it can cause a lot of problems, particularly for people with autism. If there are particular things that they like and dislike, it's really critically important. And I do like to spend time in that green area. They're things that are nice to know, but I think they're more critical than that. As I mentioned, the COVID-19 version is literally got the person's name, and there's nothing else there. So if your name's John Smith, you might want to think about maybe making it a bit more personalised or person-centred. Straight up there is next of kin and contact detail, contact phone number, and the form is specifically around respiratory function, obviously for obvious reasons, pre-existing medical conditions and medication, and then again, the whole purpose of a hospital passport is around communications. It is a passport to good quality communication to help provide better care. So I feel like I'm racing along. I'm just conscious that we've got quite a lot of presentations to go. So why are hospital passports important? Why do we do them? So, okay, my caseload right now, I've got about 30 people. My youngest is 18, my oldest is 73, and they are all individual in their own way, and they all have different ways of, just like everyone else, they're all different. And I think, if you have a learning disability, you will have some form of communication barrier, and as I said earlier, it will present itself in all sorts of different ways. But the bottom line is that you're going to have some kind of issue with communicating how you're feeling, how you're progressing, what your needs are, basic needs. And the hospital passport is really a massive opportunity to communicate on or to facilitate communications for that person. So even people with a mild or borderline learning disability can get confused, can forget, particularly so when they're not well. People have got very set ways of doing things that are easily manageable but can be strange to others, and it can make a big difference if you have those that understanding in place. People with a learning disability have more health issues, and they can be more susceptible to ill health, and it's important to recognise that because of that, they will have that the hospital passport will be there as their kind of advocate to help them to access better health care. And again, many people die in hospital from avoidable causes with a learning disability. Nicola was talking about constipation. I know we seem to talk about it a lot as nurses, but it is a fact that people actually die of avoidable, treatable conditions. Aspiration pneumonia being another key issue. Okay, I'm not sure. Okay, yeah, so I've got that might be my last slide. So yeah, communication's the key to success, and that's what hospital passport's all about. And I think I've mentioned these things before. It needs to be personal. like I said, I've seen some hospital passports where you've got the name, the GP's details, a few personal details, which is all helpful. And then after that, no problem, not relevant, none reported. It doesn't really sort of give you any real details. So I would say, the more information you put on that hospital passport, the better. The more detail, I think on some of the, like on the Distat pain chart that Nicola was talking about, some real key things. That's a good tool to look at, because it makes you think about the sort of level of detail that might be needed. Things like dietary, fluid intake, all these kind of things are critically important to good health. And the more detail you put on a hospital passport, the better. You think about an average ward. If God forbid your loved one ended up in hospital, or the person you're caring for ended up as an inpatient in hospital, you think about how busy an average ward is. You've got all sorts of different therapists going through there, nurses, care staff, consultants, doctors. You could have 30 people in 3 shifts going through that ward in 24 hours. And the idea is that hospital passport is in that person's folder, in that person's file, next to that person's bed, that staff can look at that and immediately see how they can work with that person, particularly, as I said, the critical stuff about how to do good quality communication. I dread to say this, but the dreaded copy and paste syndrome. I know we're all very busy people, and it's really easy to sort of pick up a nicely worded little paragraph. That's fine, but use that as use that as your starter for 10, and then really make it very, very personal to that person. Sounds, gestures, facial expression, eye contact, all that kind of thing is really critically important to having good quality two-way communication, and building up some sort of rapport and empathy with that person to make it really good quality care for them. And my benchmark for this is, if you had 3 or 4 hospital putting GDPR to one side, but imagine the scenario where you could have 3 or 4 different people's hospital passports. Could their family recognize their own son or daughter from just the description of how that person presents? That's your benchmark. That yes, you can actually see, or actually get a really good understanding or a picture of that person as an individual. I think that's my slide, so I'm just going to flick through quickly. Again, I've got no clock on this screen, so I've got no idea how fast I'm going or whatever, but I'm just going to quickly show you the two, so you can see the difference between the two things. So here we go. Right, so the first one, this is the standard one that I was showing you first. I've got to move the image of Asher so I can get the scroll bar. There we go. We've got the scroll bar now. So you've got the things you must know about me, things that are important to know, and then the green bit, my likes and dislikes. Next of kin, or someone there about consent and capacity and best interest decisions. So you've got your personal details, languages. This is the bit I keep banging on about. It's not a massive box, but the more detail, the more personalised, the better in there. Family contact, so mum. Any carers or support workers in there that are key workers, quite good to put in there. Support needs, so like, could put things in there around about personal care, for example. This is all the red zone, by the way. Religious and cultural needs, GP, and then other professionals working, like you might have therapists, speech and language, OT, or social workers in there. And then again, still in the red zone, allergies. This is the bit, medical interventions, where you put about, can you take blood from me? Can you do an injection? All that sort of thing. Again, more detail, the better. People might be fine with a blood test, but might not be good with a CT scan. Again, heart, breathing issues, very, very important on the COVID-19 one, which I'll come to. Any risks of dysphagia there. So again, this is all in the red. So if you've got any kind of dysphagia issues there, we need to have that up front. Again, medication. Just bear in mind, it's probably good if you put the medication just to put a date of that prescription, because they change, and sometimes these things hang around for a while. So you'd really want to be updating it if you can as much as possible, but at least yearly. But it's just a good idea to put a date when that prescription was done. Here you can put in any particular relevant medical history. Again, this is all in the red zone. And again, critically important for a lot of our guys, particularly people who have behavior that challenges. What does anxious look like? What are the, some of the positive behavior support stuff might be useful to put in there about what are the signs of me being anxious, and what, more importantly, what to do to stop me from being anxious and to reassure me. So you can put all sorts of different things in there that might be helpful. We now get into the amber bit of the form, which is about, again, communications, how to communicate with me. And remember, this is a two-way process, so how you communicate with that person and how they communicate with you back as well. Medication, pain, Nicola's talked a lot about that. Mobility, personal care, and again, that's critical for baseline. You don't want to be having too high expectations of people when they've always needed some care with toileting or washing certain parts of their body. That needs to be made quite clear there, what their normal baseline is, so we know what the care plan is while they're being cared for. Hearing, seeing, I mentioned that earlier. How I eat, how I drink, how I keep safe. Quite often, again, there's a specific reference to behavior that challenges, and obviously any little tips or tricks or things from the PBS would be good to put in there. Again, baseline on personal care for using the toilet or continence issues. And again, sleep pattern as well. Some people, that's quite important. So those are all your amber things that you really need to know about this person. And then this is my favorite bit of doing a nursing assessment and kind of getting into a little bit about really getting to know that person, about things that they like and things that they don't like, and really think about activities that person likes to do, TV shows, music, all those kind of things that really make it personal and can help build empathy and rapport with the patient and get that person sort of back on the road to recovery. And there's another little bit there where, quite often that's left blank for people, but if you think there's anything else that you need to put in there. So if you think about it, that is a pretty massive bit of work, and really the best person to do that really is the family or people that know them very, very well, and involve the person as well themselves, as much as you can in completing that form. And again, the rule of thumb is the more detail the better. That's that. And I'm gonna, just by contrast, I'll show you the COVID-19 one. And I think the idea behind the COVID-19 one is that it is just really very quick. If you need to do something in a rush, God forbid, you can get a lot of these details, in there, maybe get a few quick phone calls in to get some issues around the communication stuff. So as I said earlier, there's the name, and next of kin, respiratory function, pre-existing conditions, and these are expandable boxes, by the way, so that will push it into 2 pages normally. Pre-existing conditions, medication, some basic communication stuff there, real basic critical detail right up front, and then you've got these kind of more detail around pain and communicating pain, about anxiety and worry, and basic communication stuff there as well. And also, again, eating and drinking as well. I think that's it on that form. Okay, I've really rattled through that. And again, oh my God, we're up to 11 o'clock. I can see by my clock now. So I will stop. Okay, but thank you for listening. I hope it made sense. Hope I didn't go too fast. And have a great day. How do I get back? I don't know. Okay, that's it. Stop share. Yeah, there you go.
Thank you, Jason. So now I'm going to pass over to Afia Ali, who is consultant in Forest, who is, nope, sorry, I messed up my timetable. I'm passing over to Funmi, who works in the Bridge Community Learning Disability team and is going to talk about support discharge for